Peds Patrol here, and today we're going to be talking about back to sleep. It's to help reduce the risk of SIDS, sudden infant death syndrome. So we're here today with our lovely nurses, Pamela and Taryn, and they're going to talk to us on how to do sleep safety.
Okay, so the first step in sleep safety is picking the right crib or bassinet. So when you're shopping for a crib or bassinet, make sure that it follows Health Canada's guidelines and safety standards. When you bring your baby home, ensure that the temperature is comfortable for you, as it will be likely to be comfortable for baby to prevent any overheating.
So when placing your baby back to sleep, ensure that it is a firm surface with a tightly fitted sheet with nothing additional in the crib or bassinet, including no toys, no pillows, and no bumper pads. And you always place your baby back to sleep flat on their backs.
After feeding, some parents may choose to swaddle their baby, and so we'll show you a safe way to do so. So all you'll need is a swaddle blanket. You'll want to take the blanket and create a triangle in one of the corners, and then place it over your firm mattress. And then you're going to place baby at the head of the mattress. Okay, so the first step is taking one of the sides and folding over the shoulder across the body. And then you're going to want to take the bottom portion of the blanket and fold it up. You're going to repeat on the other side by folding over the shoulder and across the body, and then you're going to tuck it behind. So you want to ensure that this swaddle is snug but not too tight, and you can put a hat on baby. You are able to use a pacifier, but only when breastfeeding is well established.
Once your baby is old enough and able to roll, swaddling is no longer recommended, and an alternative to that is sleep sacks. So when placing baby in a sleep sack, baby will also still sleep on their back, and it allows for more free range of motion, which encourages hip healthy development. As a reminder, when you're placing baby in a sleep sack, have the baby in a onesie, and the sleep sack itself is sufficient. No additional blankets are required to reduce the risk of overheating.
Back to sleep ensures a risk reduction of sudden infant death syndrome. So SIDS can be prevented by also reducing the risk of smoking in the home and also breastfeeding. Both are protective measures. One other thing to remember is the difference between co-sleeping and room sharing. So we always encourage babies to sleep in the same room as moms and their dads, but in a separate crib or bassinet, so you can monitor your babies at all times. What the Canadian Pediatric Society does not recommend is what's called bed sharing, which is basically sleeping with your baby. And the reason being is that it can increase the risk of suffocation, as well as not being able to monitor your baby safely and appropriately.
As always, follow up with your family doctor or pediatrician if you have any concerns about your baby.
And follow Peds Patrol for more tips and information.